adults are also conceptually more problems in the realm of mental health when they used to not even consider these as mental health problems.
Yeah.
They said, oh, this is a social issue, or oh, this is a family issue, or oh, this is a behavioral criminal issue, you know, and now we're saying, oh, maybe this is a mental health problem. For example, substance abuse is more and more being put under the realm of mental health problems. It used to not be that case. It used to just all be criminal, right? And so I'm not saying I disagree with that. I'm saying the way we assess mental health problems is changing a lot.
Hey everyone, welcome to the Little Brain Campaign.
We're your hosts. I'm Jessica Eisenstadt, a licensed professional counselor, passionate about supporting kids with exceptionalities and behavioral challenges.
And I'm Lauren LaRose, a child and adolescent psychiatrist who loves diving into all things child and adolescent mental health.
Each week, we'll chat about our personal and professional experience as it relates to childhood development.
Plus, we'll bring on a guest to share their insights and experiences on important topics.
Join us for a lively discussion, expert interviews, and a lot of laughs. Let's get started. Hello, big brains. Thanks for joining us. We are your hosts, Jessica
and Lauren.
And today we have the pleasant experience to have Dr. Megan Campbell here, a child and adolescent psychiatrist here in New Orleans.
So Megan and I did all of our residency and fellowship training together. And since then, she has worked in a variety of different settings, inpatient, psychiatric unit, seeing emergency room consults, seeing psychiatric consults on the medical floor, some outpatient work. So she wears a lot of hats. And some administrative work as well. So Megan, just tell us a little bit more about what you do, what kind of patients you see, how do you end up seeing those patients? How do you get looped in as far as referrals go? And then we're just going to ask you a million questions and pick your brain.
Hey, yeah. Thanks for having me, guys. I work in a variety of settings, as you mentioned, and how I get to see kids depends on the setting. Very often I'm seeing people who are coming into an emergency room. So that's anyone. And a lot of times those emergency room kids may get admitted to behavioral health unit, in which case I may see them while they're hospitalized on the psychiatric floor. Often.
So, real quick, what would get someone referred to from the ER or moved from the ER to the behavioral health unit?
So people come into an ER for a variety of concerns, emotional and behavioral. They often come in because the parents are worried that the kids are in crisis actively. And they may be referred from either a school counselor or school administration or their outpatient counselor, therapist, psychiatrist, for thoughts of suicide, self-harm, thoughts of homicide. Sometimes kids suffer from psychotic disorders. So there's a number of different reasons. Probably the most common reason is suicidal thoughts. And people get admitted to a psychiatric unit if they have active suicidal thoughts or homicidal thoughts, or like a psychotic disorder, or they're manic or something like that.
Can you kind of define what active means?
Active means it's a current consideration.
Okay.
Any current plans, any current means. That's as contrasted to passive thoughts, just kind of an idea of I just wish I weren't alive right now, but I'm not going to do anything to hurt myself. If I'm having thoughts of actually hurting myself, we call that active.
Got it. Cool.
Okay. So, you also, besides being on the inpatient unit, you're also seeing patients in the ER. You're also seeing patients on the medical floor, right?
Right.
Tell us how do you get involved in that setting?
Those are kids who are hospitalized in the medical hospital for whatever medical reason. So they may be getting surgery, or they may be having a seizure neurology workup, or they may be on the hemonc floor getting cancer chemotherapy treatment. So it's anybody admitted for a variety of different needs, and their primary care team decides to consult psychiatry. So maybe they're having a behavioral concern, an emotional concern, and they just want a psychiatrist on board to help evaluate or treat that condition.
Okay. Okay.
Are there any themes in these emotional or behavioral concerns that you see?
Like
or
what,
that's referred to you?
anytime there's self-harm involved, so for example, if somebody was feeling suicidal and took an overdose on their Tylenol, they may get admitted to the medical floor because now they have a compromised liver function or something like that. So we see a lot of overdoses or self-harm that ended in needing medical care. We also see a lot of kids who are hospitalized for a long time and having adjustment reactions because of that. Maybe they have cancer, maybe they got into a terrible accident, and now they have deficits in function all of a sudden. Like, saw a kid recently who was a well-functioning, high-functioning teenager, and then car accident happened, and now he can't walk. So he's in physical rehab for an extended amount of times, and he's also struggling with this just huge adjustment of life being different. So he's understandably distressed and maybe depressed or anxious or having panic. We see eating disorders a good bit. People get admitted to the medical floor for electrolyte or nutritional deficiencies because of an eating disorder, and we get consulted for that. Sometimes kids may have autism, and so they get hospitalized for a medical problem, but with their developmental disability, they're having behavioral issues or outbursts. And so we come in to try and help them rest a little bit better, sleeping, or aggression or anything like that.
For this example, developmental disabilities, let's say, like you have the kid come in who has ASD level, whatever, 3, and you have a medical.
Which means autism spectrum
disorder. Oh yeah, sorry, thank you. Anyways, comes in for a medical issue. How, are there any gaps between, help me with this language, like a medical, I don't know, like a GI specialist or something.
Yeah. Non-psychiatric medical professionals.
Yes, correct. Is there a lack of knowledge about psychiatric diagnoses, developmental delays, and how does that impact care?
100%. I think that a lot of people don't really understand what to expect developmentally. Most pediatricians, so people working in a kids hospital, have a pretty solid understanding of normal developmental timelines. But throw in a complicating factor, and they have a lot of questions often about, is this what I should be expecting? Or how should I interpret this behavior? So for example, a child with a level 3 autism, that's pretty profound autism. That's really severe. And so those kids may talk to themselves or talk to an imaginary friend that's not there. And then somebody may say, oh, are they having hallucinations? Yeah. And then we come in and we do an assessment. And we're like, no, they're not psychotic. They're not hallucinating. This is typical for a 10-year-old who has autism level 3. It's not typical for a typical 10-year-old, right? A neurotypical, developmentally appropriate 10-year-old to talk at the wall, but level 3 autism, it may be. So I think we often help interpret kids' behaviors. We saw a child very recently who mom brought in for new onset hallucinations and panic symptoms. And as they were getting a workup for seizures and medical problems, and we came on board, consulted for the hallucinations and the behavioral issues, anxiety. And then through our assessments, we saw this kid has very grossly delayed developmental milestones. He wasn't walking until 3. He didn't train until 5. And so when mom is talking about this fall from baseline, we really have to get a good concept of, well, what is
the baseline?
Timmy's baseline,
Yeah.
you know? And so we were able to kind of weigh in like, oh, I think this is part of a developmental spectrum and can be managed outpatient. We don't have to admit it to a psychiatric unit, and maybe some suggestions for a mild low dose medicine that can help with that type of issue.
Okay, got it. So when we were in training, which was pre-COVID, pre a lot of this like mental health awareness on social media and everything, we were definitely, as you remember, Megan, we were kind of like the redheaded stepchild in the hospital, right? Like we, you know, psychiatry, we kind of like dealt with the patients that like, you know, a lot of these other doctors didn't, if they didn't know what was going on and they couldn't find like a lab value or an image to show what was happening, they referred them to us. And then we would just have to like do a lot of digging and figuring out. Is that still something that you see now post-COVID?
I mean, definitely. And as far as being a redheaded stepchild goes in a hospital setting, I think it has a lot to do with what the other teams are used to seeing and handling on their own versus do they have a psychiatrist readily available and they get used to that. So it used to be that they really only called us in if they felt like it was necessary 100%. More and more kids are going to ERs than ever before.
Why do you think that is?
Most hospitals don't have a child psychiatrist. That's actually a pretty uncommon thing. It really happens in like bigger hospitals or academic centers. You know, if I go to Mandeville or Covington or LaPlace or East Baton Rouge, Webster Parish, they don't have a child psychiatrist in their hospital. And so those doctors are all managing things on their own.
Yeah.
But where I work, we have gotten used to a lot more kids coming through the ER, which that's happening everywhere.
Why do you think that is?
Well, that's been a trend for the last decade. COVID
Okay.
made it worse. But that I think is a really, really complicated
let's go.
situation. Okay. So kids these days are coming into the ERs in droves for behavioral health problems. And it's not just suicidal thoughts. I mean, a lot of it is, but a lot of it is behavioral issues that get identified as psychiatric or mental health, when in the past, I don't think they were identified as behavioral.
Can you give some examples of these behavioral symptoms?
Sure. So kid gets picked up by the cops. Mom calls the police because kid is like running away, won't come home, leaving the streets. And so the cops pick the kid up and they say, okay, well, you can go home and mind your parents, or we're bringing you to a hospital. And I think it used to be that police just brought kids home and didn't have this concept that maybe there's a mental health problem going on, for better or for worse. You know, very often we're having to say in an ER, there's no acute psychiatric problem here. I see that the family is struggling with behavioral issues, but this is like a chronic, long-standing issue based in parent-child relationship problems and behavioral problems. And maybe little Timmy is smoking too much weed and hard to control.
Okay, so I have it real quick.
Yeah,
so then it's like, well, why, first of all, why are adults giving a kid? Do you want a choice like that? Like it's our responsibility to make the choice. Like you ran away from home, X, Y, and Z. It's either there's a protocol that the officer like has like in his back pocket. And he's like, okay, check, 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 check. You checked off X, Y, and Z, therefore hospital. You checked off X, Y, and Z, therefore home. You know what I mean?
Yeah, like why?
Totally.
Like
I
why
think
are
the
we get
adults-
like, why is it a choice?
I think there's a few things happening. I think one is adults are also conceptually more problems in the realm of
Mhm.
mental health when they used to not even consider these as mental health problems.
Yeah, yeah, yeah.
They said,
Mhm.
oh, this is a social issue, or oh, this is a family
Mhm.
issue, or oh, this is a behavioral
Yes.
criminal issue, you know, and
Mhm.
now we're saying, oh, maybe this is a mental health problem. For example, substance abuse
Yeah.
is more and more being put under the realm of mental health problems.
Mhm.
It used to not be that
Right.
case. It used to just all be criminal, right? And so I'm
Mm.
not saying I disagree with that. I'm saying the way we assess mental health problems is changing a lot. The other thing is I think a lot of times people send kids to the ER because there's this aspect of like either I don't know what's going on and I just want it assessed. And there's a big aspect of CYA, cover your ass, you know,
Mhm.
Yeah.
when like a counselor in a school is seeing a kid cutting
Yeah.
and they say, I can't not do something. I feel like I have to send this kid to an ER. And then
Why would they think they have to?
because they're worried that if they're missing something and the kid actually hurt themselves, that they would be liable.
Yep.
I mean, all right. I worked in a school for 10 years and I mean, it wasn't common, but there would be a kid who would come in and maybe not like actively be bleeding like on my floor. And they would verbalize like, I cut before. And so then I would do the assessment. And like, you know what I mean? Like I am knowledgeable, should be, right? I mean, every professional, mental health professional in the school should be knowledgeable and have that like educational background to provide an assessment. And then you go and look at your ethical standard. You know what I mean? Like,
100%. And I totally agree that we should enable professionals, including teachers and school
yes,
social workers and all these people, and pediatricians,
yes,
do their own assessments. But then I really think that people just get this
scared,
Scared.
scared,
quit
paranoid
being little
of,
bitches. Just kidding.
well, even
But
if
they
I
have
did
reason
an
to be
assessment,
I mean, yeah, I know, but
Right?
like, I guess, yeah.
They,
No, I mean-
unfortunately,
But like, uh, all right,
you know, like I
Whatever.
think that they have become scared because of things that have happened, right?
but
Like-
you have
like
malpractice.
lawsuits.
Like lawsuits. That's
Okay,
you know,
but like then look, like go through your ethical decision making model.
I don't
Hello,
disagree with you. I think that they
don't do
should
that.
be, like Megan said, I think that they should be empowered to do their own assessments. I think that we've gotten into this situation though
I'm
because
scared.
of fear, because of fear. But okay, so Megan, tell us like what do you see are the potential consequences of this massively increasing referral of kids to the ER? And which is happening, like you said, not just in New Orleans where we are, this is happening all over the country, right?
And it is. And remember how we said most hospitals don't have
Yeah,
Yep.
yeah.
child psychiatrists
Mhm.
or psychiatrists at all. Well, then you'll also get the pediatrician or whoever's in the ER also feeling like, I'm not sure what to do here. And so I'm just gonna
Mhm.
put in an emergency hold in this kid and get them onto a psychiatric unit. So I think we're seeing more and more hospitalizations that are questionably necessary, but people do it because the concern
scared.
is there. And to some extent, it is valid, right? Because the rates of suicide are increasing.
Yep.
We
Yeah.
have to take this problem seriously when kids are dying. The number one reason children die from ages 15, 12 to 18 is suicide.
Yeah.
Yeah.
And so, I mean, part of it is me saying, oh, maybe we're doing it too much. But the other part is really real is that there's an epidemic going on of increased suicidal thoughts, self-harm, increased attempts, and unfortunately, kids are dying at the
No,
same
you're right. I
time.
retract everything I said because I'm going to get people are going to hate the way I answer that. And I'm going
It is
to
true.
send them all to the hospital. Oh, you're
Well,
right. No, but
I
seriously.
think that both are true at the same time. You know
Yes.
what I mean?
Yes.
Which
Two things can be
culminates
true.
Yeah.
in just they're coming in droves.
Yeah.
And you know, if my child went to school and said he wanted to die, his teacher would send him to an ER. And then in the ER, that pediatrician would PEC him, and I would have very
What's
little.
PEC?
PEC.
A PEC is a physician's emergency commitment, and it's a piece of paperwork that essentially says it doesn't matter what the parents say, we have to legally hold this child in a hospital setting.
Which is
And that
traumatic in and of
usually
itself.
means it's hard. It's hard. And a lot of times it can be reassuring and healthy and good where parents are saying, I know my kid needs help. I just want the best for them. Let's get them where they need to go. And sometimes people are very anxious about what to expect or what it's going to be like, or having their child away from home for a little while. And so it can be hard.
Yeah.
We digress, but we were talking about increased rates of suicide.
Mhm.
Yeah.
That's paired with things like, well, you know, our gun laws are really not supportive for kids who are having mental health problems. As in, it's really, really easy to access a gun.
I mean, is that
Where-
I'm going to say the wrong thing. Is that a popular choice of
In the
Means.
South, it is. In the
Yeah.
South, people
Okay.
are very, very much advocates of strong gun rights, right?
no? Oh no, I meant like
Is that a common means of
carrying
preventing
out
suicide?
Yes.
Oh, yes, it's the number one.
Okay.
Okay.
And
Plus.
kids?
Yep. It's
Okay.
actually the most, when we talk about suicide rates increasing,
Mhm.
we can also say a different statistic, which is the number one killer of children right now is guns. And that includes suicide attempts and
Or
it includes
accidental.
accidents.
Yep.
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 Yeah.
And actually accidental death by gun is a higher rate than
Mhm.
suicide by gun for kids.
Yeah.
Okay, wait, let me ask you
It's like
this.
the 2-3-year-olds.
Is a gun the most common means of suicide attempt or completed suicide?
Gee, this is going dark, y'all.
Completed suicide.
Okay, yes, because it's like a very lethal means, right? Okay, anyway, sorry. Yeah, we can
That's
move on from that.
I don't know.
Okay, so as far as this trend that we're seeing all over the country with increasing number of kids being referred to emergency rooms for mental health issues, what is your professional opinion about why that's happening?
Whew. That's the $1 million question, because I feel like if we knew exactly why, we'd hopefully be able to put a damper on it. But I think that kids today face a myriad of stressors that are increasing or are worse or we didn't have before.
Mhm.
And that includes, you know, COVID drove up rates of anxiety and depression and mood disorders and abuse and substance abuse, all skyrocketed. The opioid epidemic, I mean, these things don't just affect grown-ups. These are parents who are addicted
Yeah.
to one, right?
Yeah.
And that means kids are being exposed to it. They're being emotionally neglected. They're being also exposed to drugs. They're trying drugs at a younger age. So the opioid epidemic and other substance issues are affecting kids. COVID's affecting kids. Look at all the social media stuff going on right now.
Thank you.
There's legislation that's finding out that kids who are on TikTok and the Twitter and I don't know, all these
The Twitter, as they
It's
say.
X.
X. It's X.
Oh,
now.
X, right? It's
Yeah,
X now. Sorry.
yeah.
And the one where they dance and record themselves dancing.
TikTok,
That's
right?
TikTok.
Okay.
Yeah.
WhatsApp? No, not WhatsApp. That's not. I'm
Instagram,
pretty
yes,
uncool.
et
I'm
cetera,
very
et cetera.
uncool, so I don't really know, but I do know that there have been very consistent studies demonstrating that kids who are spending more than 3 hours a day on social media have higher rates of depression and anxiety and mood disorders. It's just simple. So there's a lot of legislation right now that's putting pressure on these tech companies to try and do something, filter
I
it,
know.
ask
I
for
said this to Lauren yesterday. Okay, fine. Like, yes, that's an enormous amount of time on any social media platform, screen, whatever. And is that the platform's fault, or is that the guardian's fault for, I don't know, like not setting limits or whatever?
It's so hard because it's also like, this is the world we're living in now.
Mm-hmm.
I mean, it used to be that our parents didn't have parents are being asked a lot of different things at the same time, right?
Yeah.
One, set more limits, supervise your kids more, and give kids more freedom. You're helicopter parenting, stop
I know.
helicopter parenting.
Yeah.
And it's like, well, which one am I supposed to do?
Yeah.
But I mean, there is no one size fits all. That's why, like, sorry, Dr. Becky, you have like Dr. Becky out there who's, I don't care, who is like, has a kind of like an intervention prescription or
Yeah.
like a prescriptive like theory or whatever that she's branding as like applies to everybody. Everybody should do it. Right. And like, no, that's just like not how the world works. It's like this co-regulation, whatever, like may work with kid A who's diagnosed with autism, but kid B who's diagnosed with autism is presenting in a much different way in a different family culture with values X, Y, and Z. So like that it just bothers the shit out of me. It really does.
It's so hard. And it's so easy to say everybody should behave a certain way or act a certain way or parent in a certain way. And let's be real, families look really fucking different. Sorry.
Yeah. No, they do. We're
Cool.
cursing here.
You
I
can do that.
Families look really different. Maybe I'm a single mom who just went
Correct.
through a divorce.
Yep.
And I'm having to pick up a second job to raise my 4 kids.
Yep.
And
yes. I gave you this example.
Yeah.
right. And
Yeah.
like
Watch the TV.
I was present more.
Yeah.
But I
Yeah.
have to come home and somehow cook and clean on
No,
top
totally.
of 2 jobs. And I don't, thank God they're on social media.
No, totally.
Because otherwise they'd be running the streets,
No, yeah. Yeah.
So I think that it's a little,
No, it's more complicated.
a lot of pressure on parents and women
Yeah.
to somehow be everywhere at once, do everything perfectly. And, I mean,
There ain't no such thing.
parents were locked out of the house for 5 hours of the day because their mother, my grandmother said, I'm cleaning the house. Y'all get out. I don't even know
Yeah.
where she didn't know where her kids were.
Yeah.
They didn't have social media. They didn't have cell phones. So there was a different way of parenting.
Well, there was this trust, right? You just trusted that your kids would make decisions.
Okay.
Yeah.
Yeah.
Like that would keep them safe because you parented them in a way, right? That they gravitated to. I guess. I don't know.
Had less options for getting in trouble.
That's true too. I don't know.
And then other adults were less judgmental and punitive. If a kid
100%.
to school or walked to the corner store to get a snack, these days people will be like, where's your parent?
Yeah, that's right. Yeah, I used to walk to CVS all the time.
Yeah, of course.
Get a lit macker.
So the world looks so different, I think now.
No, totally.
Well, like going back to that, is it the social media platform company's fault or is it the parents' fault? I feel
it's
like
everyone's fault.
Well, but I feel like, the social media platforms knew what they were doing to kids long before the parents realized it, right? Like they knew, they had research and data showing what they were doing to kids' brains before most parents had any clue that that was going on. I think some mental health professionals were kind of like suspicious earlier on. I remember like before all these studies kept coming out, like seeing kids in my office telling me these things, and I'm like, there's a connection here that I'm making. But that information was not released to the public until very recently. So
well, I think there's a reason, I think I read like Tim Cook or one of those big Apple CEOs, they don't let their kids have cell phones.
Yep.
And it's like,
yeah,
there's a reason there.
There's a reason.
But is it because they can? They can, because they're not the single mother of 4 in the Midwest. You know what I mean? Like they have that ability to be like, nope, go play outside. Nope, go read a book. Nope, go. because
And they can afford a nanny.
correct.
They
Yes.
can-
Correct.
And they can have these large, expansive grounds where the
Yes.
kids can play
With
outside.
cameras and bodyguard, you know.
But
Yeah.
they also like, they see like how dangerous it is from the inside, right? So they're probably going to take that more seriously than maybe some other things that other parents are going to worry about. Like, like they might take that more seriously than their kids, I don't know, being exposed to a bunch of sugar during the day or,
Yep.
whatever it is. You know what I'm saying? Like that's their cross, that they're
Right.
bearing, I guess.
Okay.
So are you seeing like in real time in the hospital, in the emergency room, on the inpatient unit, are you seeing social media being a factor in kids' mental health?
Yes. I think that kids' self-esteem sucks. And I think that that has a lot to do with them feeling socially isolated. They're not hanging out with people in person. They're not even hanging out with their families in person. When we ask, like, when we really dig down and like, well, what's your day look like? What does your house look like? And a lot of kids are saying like everybody just kind of stays in their own room.
Mhm.
We don't eat
Yeah.
dinner together. My mom sits in her room and is on the phone or on the internet, and my dad isn't there, and my brothers and sisters are in their room on video games or on social media. And I mean, how depressing. Imagine if the
depressing.
screen weren't there, but it's just replaced by everybody
Connecting.
being isolated. Yeah.
Yeah.
So I think it inhibits real connection. I also unfortunately see a number of kids who are getting into a lot of distressing or troubling situations because of social media, like
Wow.
meeting older men, like girls who send, are getting texted to send nudes. Oh, now share your address, things like that. So
Yeah.
there's a lot of predators that fish for teenage kids on the
Yeah.
internet. And that's really scary too.
And like that's an episode, like
Yeah.
within itself. And we're like, there's so much content that we could
Oh
like
my
be
gosh.
picking your brain about. And that one in particular could be like
Yeah.
a very fascinating one. And
And
Shay's been
kids don't
17.
know, when I think I read the statistic that by the age of 14, like 80% of girls had a request for explicit photos of themselves.
Oh
Yeah.
my
It's
gosh.
wild. It's so disturbing.
That's-
It's
yeah.
basically
Disturbing.
everybody. And that's not something my parents didn't have to warn me about the dangers of somebody texting me, asking me for nude pics. That wasn't a part of me growing up. So if I didn't know how pervasive that is, I wouldn't even think to tell my
Right.
kids, to warn my
Correct.
kids about it. But
Yep.
it is true. And did you know in state of Louisiana, so if you send a nude or sexually explicit photo, that is child pornography, right? Because you're actually sending via media a picture of an underage person, even if it's of yourself. So if
Yeah.
I'm 15 and I take a, bra pic or whatever and send it to my 17-year-old boyfriend,
Now we're
I
in illegal.
have actually just committed a crime.
Mhm.
And my boyfriend could get charged with a crime and I could get
Mm-hmm.
charged with a crime. I don't think it happens a lot, but I've seen it happen.
Yeah, it does.
And that's, I mean, could you imagine being a 15-year-old girl and getting, or a 15-year-old boy and getting charged with these
I know.
child pornography charges? That's insane. It's scary.
Yeah.
And kids don't even realize what they're doing
No. Well, they don't have any impulse.
because
control,
adults don't even realize that it's a
Yeah.
thing either,
Yeah. Yeah.
Okay. Well, we're going to have you back to open that
Yeah.
can of worms
Yeah. Big one.
further.
Yes. Megan, thank you so much
Thanks,
for
Megan.
joining us on the Little
thanks
Brain
for having
Campaign
me.
podcast.
Pleasure talking to y'all.
All right. We'll have you back soon. Sayonara.
Have a great day. Thanks.
Okay.
Bye.
Bye. We hope you enjoyed the conversation and gained some valuable insights.
Don't forget to subscribe, rate, and review our podcast. Your support means the world to us.
And if you have any questions or topics you'd like us to cover, hit up the Little Brain Campaign on social media. Until next time, keep those little brains growing. This podcast is for informational purposes only. There is no one-size-fits-all. Always consult with a qualified professional for personalized support.